Vidya. Vijay, how do you make your patients come back after they've happily gone taking home a healthy baby? Because we have noticed that pre-pregnancy, they'll not listen to us. Post-delivery, they're gone. Only in pregnancy, they are so serious. They very meticulously follow everything and anything that we say, and even more to the extent of diet restriction and starvation. But post-delivery, you ask them to come at 6 weeks, 6 months, annually. How many of them actually come, and what do you do? And what is your protocol?
Yeah, definitely. We would like 100% follow-up. It's beyond our, I won't say it is beyond our expectations. Definitely, it has to be there. As you correctly said, the testing which we do for screening during antenatal is easy. Nowadays, with a little more clarity of concepts and of course introducing the single step test, but at the same time, even the fasting sugars that they do along with other evaluations which is advised during thyroid and all those things, they also give us a clue. So it is still existent that not all the patients go through single test, but then yes, something is detected even in the fasting or not detected, we follow it up with a DIPSI test, or even later with if some of them are positive and they go through the MNT or the insulin. And because ours is a multi-specialty hospital, the physician is also involved. And I think along with the obstetrician, it is very important that the physician or the diabetologist is also there, because these people need definitely the long-term care. And we cannot, though we know we don't segregate the systems or the specialities, and mostly they are under our cover, but at the same time, they definitely, somewhere they branch out and then they get lost for follow-up. And therefore, it is very important. I would suggest that postnatally, yes, when they come to us for the follow-up of either the cesarean scar or the episiotomy, and that is the time we keep talking about this and what they have gone through during pregnancy as a follow-up or difficulties in pregnancy or management. And, maybe we are scaring them, but then yes, we have to tell them it should not repeat. In your next pregnancy, you have to be careful hereafter. Pre-pregnancy, try to achieve a planned pregnancy, especially if you have been through a diabetic state during pregnancy. You definitely need to plan your next pregnancy. Just like how we give them the contraceptive visit, we definitely stress on this as well. And most of them are able to do that. Of course, some are lost for follow-up, and something because the sugars have been normal after delivery, they have been weaned off the insulin, they have been weaned off the oral antidiabetics or even anything, and they have a liberal nutrition after the delivery. And some at home, feed them with bunches of this because you are lactating and definitely you need more nutrition. All these people, we do give warning symptoms that once you are diagnosed as diabetic in pregnancy, you run a risk of being diabetic, continue to be in a diabetic state hereafter, and you have to be warned. And then the 6 weeks, 6 months follow-up, and definitely a prenatal before they embark on the next pregnancy. They are able to do it, but yes, we have to keep on hammering this on them. And the only thing is, we can ask them to come for some other excuse. Say when they are coming as a post-contraceptive, post-IUCD visits. See, these are the time again and again you check. I know in our hospital what happens if a neonat is going into an ICU or had some special consultation postnatally, they are branded as a high-risk babies and they keep seeing them. I think what we do is we manage so many risk pregnancies, but then, we don't get all that credit if all goes well. And then later on, we forget that they are branded into risk category. It's not to scare them, but then we have to be vigilant as well as they have to be vigilant that they carry the risk of running a hyperglycemia anytime in life hereafter. And I think that follow-up is very, very important. We need to put them in a little different bracket, not just because they have gone through a very smooth sailing during pregnancy. That is because they have been managed well. But then they do run that risk of getting into trouble in the next pregnancy, or even if they are not going to be pregnant again, for their any general effects and general life thereafter. So I think stressing on the nutrition, stressing on the diet pattern, watching the weight, especially the central obesity, they have to do
Right.
that. And exercise is important. And then not just putting abdominal binders and trying to tuck in and then say, oh, I've gone down. No, that is a false this thing. They have to make it through the muscle exercises, cardiac
Sure.
exercises and all those things. Keep a watch and then keep reporting to us at some excuse. And here we definitely follow. Because I put something on them, on their case sheet or whatever, our computer thing, so that I know, yes, they had GDM or they were diabetic at some stage, and we need to really keep on pushing them into this. And
Excellent.
all our, if we have been involving other specialities, then I think it is also their responsibility to contribute to this. Sometimes they just get diluted in that management.
True. And also simple advices like, continue to exclusively breastfeed at least for 2 years. And then, your weight will be lost and you'll have less chances for type 2. All of these have to be drilled in whenever the opportunity is there. And, is there any strategy of, calling that patient, making a list and calling the patient back if she has not come for follow-up after 1 year?
We can do, because luckily I'm in a private institution and we don't cater to a huge volume. So definitely, but even here, every 3 patients, every 4 patients, one is diabetic. So definitely we do remember them, and especially if we had tough time during pregnancy, we can never forget them. But at the same time, definitely we can and we should definitely enlist them, and then we can surely enough we should be able to contact them and say, how are you, did you check with your sugars, why you didn't come? I think we need to do that outreach programs, because even today I find patients who come from abroad halfway in pregnancy care and they come here for some reason, either intermittently for a checkup or maybe they have shifted their delivery point or whatever. Some are not done sugars. I don't know. Abroad, they have no concept that basically they are Indians. Whether even otherwise we need to do the sugars, but basically with the Indian ethnicity, they would have done lots of chromosomal screening, lots of hereditary disorder screening, but simple sugars are not screened enough.
Absolutely agree with you.
Come here and we do the testing, they are hyperglycemic. So I think we need to tell them that no, just because you did not go through in your half of pregnancy this kind of a screening, you need to take care of it. And hereafter, whether you return to US or UK or anywhere, remember that you are basically, how we call nowadays Indian origin. So the same, they carry those genes. And I think you have to tell them, as everybody said, when you talk about the kid, you talk about the children, you talk about their problems, because you have not managed yourself well, then obviously that will give a big warning sign on them. So
these are exceedingly important and very real points, which every one of us needs to keep in mind. And thank you so much, Vijay, for being here first. You were the earliest one to join in, and then, I've kept you waiting so long. And still, after Bhavatarini's comment, I have to go to the Dr. Vijayalakhsmi, who is behind us all since decades in IOG.
Thank you, Hema, for this wonderful opportunity.
Thank
you. With you in everything you do.
Thank you so much.